So my experience of home working has been really good. I found it more productive. The days have still been long. They've been compressed, which is nice. So they do start early. During the height of it, we were certainly on by 7:30 using technology. Um, the home working has also been supported from the region. So the regional director came out and said about people's welfare, which is really, really important because some people like the social interaction of
Yeah.
work. You go to work for social interaction, but you don't realise that in that interaction, you're actually also doing all the good things that you should be doing. So you get up to make a cup of tea, you can nip to the loo, you can do all of these sort of things. But through the height of this, because people were working in such a different way, there was an awful lot of work going on. You could end up with meetings completely through from 8 till 6 o'clock at the night, back to back to back to back, and therefore you were struggling to get a meal break. You're struggling to leave wherever you were working from. And one of the regional directors said, "Come on, if you're having an hour's meeting, compress it to 50 meetings, and always give people those 10 minutes, and don't squeeze something in. If you've got 2 hours of a meeting, make sure you literally switch your video conference off and stretch your legs, get a cup of tea, whatever you want to do, and make sure everybody every day between what they'd normally take as lunchtime has it blocked out so people can't automatically put you in meetings." We've rolled that out. I've certainly embraced that and rolled that out with colleagues. So we've got a lot of meetings as we try to develop into the Leica that are over 2 hours. So we have the break in the middle. And you know it works when everybody comes back. So my personal thing is I've really enjoyed it. I really find it's a good way of working. I think going forward, we need to embrace this far more. We really do need to look at, is it necessary to travel? What about the estates?
Yeah.
We don't need the big estates if we've got more people from. I'd say not to make it mandatory, because most people applied for a job didn't apply to work at home. So some people will not be as enthused as I am. So we need to recognise that and support them. It's also for leaders to recognise that when they're talking to people, because you don't have that close human interaction, that you also provide support to the individual. It takes nothing to have a 2-minute little chat either before, at the end of the meal, end of the VC with individuals. Make sure that they're feeling okay, they're getting the breaks, they're not feeling pressured. Because don't forget, working from home, everyone says it's greater, more productive. So you then fulfill your prophecy of making yourself work harder. So you're making sure that people are working at pace. You watch people that they're not sending emails on hours and all this sort of stuff. So even that, you need to have a little bit more mental thought about making sure that your team and people that you're working with are coping as well. It is interesting also to see with other colleagues. I was on a video conference the other day where a GP actually used the word reinvigorating his vocational career, which I just thought was the most powerful statement ever. And what the doctor was saying was the fact the way the GPs have got the new ways of working, they're actually triaging the calls, they're actually making the people that are coming into the surgery who have got non-COVID symptoms, they're getting an absolute service. They need to be there. They're valuing the patient's time because the patient's getting called, so the patient doesn't have to drive into the surgery or public transport into the surgery. They get a telephone call at approximately the time that they're going to, but they're free before it and they're free afterwards. So the patients are giving positive feedback. They feeling they're able to do quality time because if somebody needs to be triaged that little bit longer on the phone, they can do it. And if somebody has got COVID symptoms but needs to be seen, they can be sent to a red centre, one of the centres that's geared up. So they're actually saying it's really doing it, and they're hoping that if they can sustain that, it will also bring in more primary care clinicians to say this is the career that we want. We don't want to have the sausage machine from 8 in the morning till 7, 8 o'clock at nights where you're doing everything. So it is working really well for them as well.